On top of that, devastating impact on psychosocial development. We've seen a 30% decrease in the number of cases of child abuse and neglect since schools were shut down. And
Wow.
I'm here to tell you that's not because child and abuse and neglect went away with these kids being locked at home with their parents for the past 4 months. It's because teachers are the number one place that gets picked up. It's the football coach, the health teacher, the math teacher who picks up that neglect and abuse. Same thing with hearing and vision problems. They aren't being reported because kids aren't at school where those things get picked up. So that's the number one thing that we need to be doing, or we should stop doing that they're talking about. We need to get kids back to school.
That's interesting that you brought that up. I never considered that before. That school almost acts as a like a third party. That if a kid's having trouble at home, if there's not school or any kind of outside influence, nobody picks up abuse or medical problems, huh?
You better believe. Think about all these kids who have problems with abuse, whether it's physical abuse, verbal abuse, sexual abuse. Those kids have been locked at home with the perpetrators for 4 months without anyone to talk to, anyone to intervene, anyone to pick up on that. And we've seen a 30% decrease in reports, so we know it's real.
Right. Okay, so there's something that they're not going to do that you would do. What's something they're doing to mitigate COVID-19 that is fruitless that you'd do away with?
Wearing of masks, the idea of healthy people wearing masks, it simply defies the science. We have somehow managed to survive threats to our health every day. If you had any idea the number of viruses that are out there, bacteria that's out there, parasites that are out there, yet we don't succumb to all of this stuff on a daily basis. And here, there are a couple reasons why. Number one, we have healthy immune systems that are capable of fighting these things off. Now, I'm not talking about that small group of people who we know are in the high risk category. I'm talking about the rest of us who we know are not going to become significantly ill if we contract it. The idea of healthy people wearing masks or healthy people socially isolating is unprecedented. Then people say, well, if masks don't work, Dr. Victory, why do doctors wear them? Well, I'll tell you why doctors wear them. Doctors wear them to, number one, I wear one to protect myself from being inadvertently sprayed with a bodily fluid, blood, feces, whatever else. That's why I wear one, so I don't get splashed in the face. Or, number two, to keep me from inadvertently coughing or spitting into an open wound. That's it. I don't wear one to keep from spreading the cold I have or to keep me from getting the influenza from the patient. Okay? So that's why doctors wear them routinely. Furthermore, I wear a mask in a hospital in an operating room, a largely sterile environment where there isn't pollen, there isn't dust, there aren't all sorts of different sort of allergens and environmental particulate matter that clogs a surgical mask up very, very quickly. So the idea that people have said, well, if a doctor wears a mask in an operating room, it must work to contain a virus, simply isn't the case. And there are lots and lots of studies out there now that will show you that that's not the case. The CDC's own website has a meta-analysis of 10 different studies on it about masks, and they come to the conclusion that wearing masks offers little to no protection from the spread of a respiratory virus.
Oh, that's interesting. You've brought up the CDC several times. You know, the guy that runs the CDC, you're much more interesting to listen to than him. I just wanted to tell
Well,
you.
Dr. Fauci is undoubtedly a very bright man. I've never met him personally, and I have avoided criticizing him personally because I don't like it when people do it to me. I have no doubt that he is well trained. I will tell you that he hasn't had a stethoscope in his ears for probably 40 years, and I don't think he's touched a patient in probably that long. So I think we are doing ourselves a disservice as a country when we are allowing the people directing the decisions, these major decisions that are having profound impact on the entire population, to be relying simply on a group of people who doesn't practice. There is a growing number of us now. At least it was very lonely in those first months. I was out there by myself. Now there's been a growing number of vocal physicians who've been willing to join in. But practicing physicians, those are people on the front line, have an awful lot to offer to this in terms of our experience, what we're seeing out there, what's working, what's not, who's getting this, who's getting sick, are the hospitals actually being overrun. It's one thing to rely on the mathematicians and the modelers and the epidemiologists early in those first days of the thing, but now it's time to rely on the people who are actually on the front lines.
My guest tonight, Dr. Kelly Victory, joining us so kindly from Colorado. I wanted to get, before we end the interview, so many doom and gloom predictions that this thing's going to last through summer of next year and all that. You seem like a happy, positive person. So I just was curious whether you had a best case scenario picture or something that you can see that's positive in us coming out of this if you had a prediction to make.
Well, here's what people need to understand truly from my mind. First of all, we are not going to eradicate COVID-19. So people need to stop talking about, once we get rid of the virus. We are not going to eradicate COVID-19. We've eradicated a handful of viruses in the history of medicine, smallpox being one, and we aren't going to eradicate this one. All we need to do is protect and make sure that the people who have high risk of becoming profoundly ill from it are protected. We now have a handful of very good, quite effective treatments for COVID-19, and that's a great thing. I'm not plugging any particular one of them, but we do have some good treatments out there, and we've learned that. Hydroxychloroquine is certainly amongst them, and there are others that are being studied. I think the most important thing we need to do, Jonathan, is stop responding to the case number, because the case number, in my mind, is essentially irrelevant. 85% of the people, 85% people who get this virus and have a positive test have few, if any, symptoms whatsoever. So I don't care if there's an uptick over here or a spike over there in quote unquote cases. And the reason why is because never before in the history of medicine have we gone about mass testing people for an illness for which they have no symptoms. It would be tantamount to you saying, hey, I feel great today. I was just going to go to the gym, but I thought I'd swing by my doctor's office and get a quick test for strep throat. I mean, the doctor would look at you like you were insane, and he certainly wouldn't comply. Or, I feel great, nothing's bothering me, but I'd just like a quick chest x-ray to see if I have evidence of pneumonia. I mean, we don't do that. So for all we know, if we randomly tested hundreds of thousands of people every flu season who were well people without symptoms, lo and behold, we might find out that we actually have a pandemic, quote unquote, every year of influenza. So we need to stop looking at that number, because it's one thing if you're looking at the number and you're testing people so that you can actually calculate, if you had that denominator, how many Americans actually had COVID, then we could actually calculate truly what's the mortality rate. Because you need to know how many people actually had the disease to come anywhere close to, figuring out what's the actual mortality. But when instead you're using that case number to direct public policy, then you are really going down a very dangerous rabbit hole, because the case number means nothing if it doesn't translate into people becoming ill with it, needing hospitalization, or God forbid, dying from it. If it's just that, I had a swab shoved up my nose and it came back positive, who cares?
I love that. Okay, so I know other people will be interested in this, but chiefly I'm interested in this. Tell me, you've written any books, or you're on the radio, or where can we find your stuff? Or if anybody wants to do a crisis leadership seminar, where can they find you?
The easiest, my blog is no longer active because I just am too busy for it. But I do a tremendous amount of radio, primarily on the West Coast, but I'm on KABC out of LA.
Oh.
I do an hour with them about 4 days a week.
Wow, that's a major station. That's one of the best stations in the country.
It's a great station, and I take calls and answer questions, so you can actually get me there. And I Twitter is, believe it or not, my only social media. I've never been on Facebook. I don't have a Facebook account, but I am on Twitter at Dr. Kelly Victory, and I really do answer people's questions. Or if you reach out to me and want to get in touch for anything, whether it's to do a show like that's how you got me today.
That's right.
You sent a tweet to me, and I do respond as quickly as I can, and then connect with people so that I can do these sorts of things, which I really enjoy. And I'm happy to talk to people about leadership in times of crisis as well.
Well, I can't thank you enough for coming on. You did a 5-star job, and we're happy you took time for us. Dr. Kelly Victory, everybody.
Thanks for the invitation.